My name is Angela Walker. My student ID is E2896913, and I'm currently attending the veterinary nursing fall 2019 class.
I'm going to start by looking at my patient's mouth, looking at the gums, making sure that they're nice and pink, checking the capillary refill time, making sure it's less than 2, because that that indicates how the blood circulates and the blood pressure, etc. So make sure that's looking nice and great. Then I'm going to go ahead and start it on the left side and listening to the aortic, the pulmonary, and the mitral valve on the left side. First, right behind the elbow. So I'm gonna use my flat side, the adult side, and I'm gonna listen to that for about 10 seconds. Also, I'm gonna make sure to feel his pulse at the same time. Listen for that lub-dub sound. Sounded nice and normal. My pulse is nice and strong, and it's in sync with the heart rate. I don't hear any swishing sounds, anything abnormal. So I'm gonna listen. I have a clock of second here behind me, but I'm gonna listen for about 6 seconds. Then I'm gonna multiply that by 10. Okay, so his heart rate's around 70. He's pretty calm, so I'm gonna go ahead and listen to the right side, which is that tricuspid valve. And again, I'm hearing that same lub-dub sound, nice and normal. Lub-dub. First, I'm going to start by looking at our patient's nares. So we are looking for any nasal discharge, the size of the nares, upon inspiration, if I can feel it on my hand. I can feel it nice and strong. Feels normal. And I'm going to go ahead and look in his mouth. Looking at that hard and soft palate. I don't see any holes or anything obstructed in there. I don't see anything in there. So I was upper respiratory tract first. So I did that, and I'm going to go ahead and listen to his trachea. Alright, so listen over that trachea. It should sound like nice, hard, and loud and harsh sounds. Anything high-pitched can indicate an obstruction. Okay, then I'm going to go ahead to his lung lobes. So the lungs have 9 quadrants. So I'm going to listen to each one of those quadrants for about 2 to 3 respiratory cycles. And starting from
left to right. Listen for any wheezing, crackling.
Any wheezing or crackling in the lungs could indicate pulmonary edema, and any absence of lung sounds could indicate pleural effusion, masses, or consolidation. I'm gonna go ahead and do the same thing on the right side.
Right, and that's how you.
Listen to the lungs on a. I'm going to go ahead and show you where all the leads are on our patient that he's currently recovering from a surgery. So, where his leads are. So we have a lead on his right arm, a lead on the black lead on his left arm, and then the red lead on his left lower leg. So I have applied alcohol to the skin where I've attached these leads. There's other ways you can do this, such as clipping the fur if the fur is really long, and applying the gel that we do have. But for time's sake, we just, if it works, we spray it on there, spray the alcohol on there, and it reads that way. So we've just been doing it that way. Show you. This is our ECG results. Okay, so yeah, making sure that there's a P wave for every QRS wave, and that the distance between the QRS wave and the P waves are all normal. We don't have anything lacking or any big gaps between those T waves or QRS waves. So yeah, everything looks in unison, and electrical activity looks normal. So okay, so today I'm going to demonstrate how to put on a rabies pole. So we have a makeshift rabies pole. We don't have the fancy device, but typically in these situations we would use this device in patients that are really aggressive and trying to lunge at us and bite. We're going to stand behind her. Well, first I would stand behind them and get over her neck. And I would just pull this. So vicious. Pull this and get it tight. Get it tight around her neck. And then I would just pin her to the floor, and we will give injections or whatever needed to get her sedated. But yeah, that's how you turn her. The disinfectant I have is Vtht and Kennel disinfectant. It's made by Hilliard, and so I'm going to go ahead and spray all surfaces of the kennel. Top and bottom, and you can't forget the door. And we're going to let that sit for a few minutes so it can kill the bacteria. And I also spray my towel just for extra. So while that's marinating inside of the kennel, I'm going to go ahead and clean the door first. Sat for about 5 minutes. So I already cleaned the door, so now I'm going to go ahead and start from the top, and then do the sides of the kennel, and then do the back of the kennel, and then do the bottom. And the reason for that is because we don't want to transfer. These are the least contaminated. So you want to go from least contaminated to most contaminated, so you're not spreading contaminants and bacteria all over the kennel again. So that's why we go in that order. So, starting from the top. I'm gonna go to the bottom. And that's how you probably clean it out. Demonstrate how to test for KCS using the Shimmer's tear strip test. So I'm gonna make a fold right there at the 0 line. Okay. Then we're going to take that. Today, our patient, it's not required that our patients be sedated, but we're just demonstrating this on a sedated patient. Currently recovering from a procedure. So I'm just going to press that right under the eyelid. And you want the tear production to be 15 or more. So I'm going to, once I put that in, I'm going to go ahead and time. I have a second hand behind me for about 60 seconds. About 60 seconds. So our patient tear production is at 10, but also our patient is sedated, so that could throw that tear production off. So, but typically tear production should be 15 or more. So, but yeah, that's how you demonstrate how to do a Shimmer's tear test. Okay, so I'm going to demonstrate how to measure the ocular pressure on a dog. We're looking for making sure our patient doesn't have glaucoma. First, I'm going to go ahead and use some, I'm going to use some proparacaine to first numb the eye. Just 1 drop. And this is just for demonstration purposes. Our patient does not truly have any eye problems. So this instrument called AcuPen doesn't need to be calibrated. It's been calibrated already at the manufacturer. So first I'm going to turn it on so it beeps for me. Then I'm going to go ahead and press my action button again. And now that that little dash line is thinking, it's ready for measure. So I'm going to, our patient, make sure the head is nice and parallel to the pen. I'm going to go right in the center of that. Alright, so typically this instrument will be beeping or making a little noise. But our instrument is malfunctioning a little bit, so but typically you would keep the eye nice and level to the tunnel pen. And so, and our normal measurements is from 10 to 25. But like I said, this instrument is malfunctioned, so but that's our demonstration purposes for that. Okay. So I'm going to go ahead and put a drop of eye wash on the strip. And hold it above the eye. Drop on there. Hold it for a few seconds. And then I'm going to use my ophthalmoscope. Alright, and I'm going to go ahead and use my ophthalmoscope to see if I see any I'm checking for any staining, any spots in the eye, any ulcers. I don't see anything stained. So I'm going to go ahead and rinse the eye out. using some eye wash. That's how you stain the eye for using fluorescent stain. Okay, so I'm going to demonstrate how to express anal glands. First, I'm going to put a little leaf on my finger. And the location of the anal gland
Yourself.
are at 5 and 7 o'clock. So, gently in. And the first thing I am doing is feeling sort of the texture and the firmness of the anal gland, which it ranges from soft to pliable. So his anal glands are pretty. So the consistency of the anal glands should be loose and free flowing versus being thick and chunky. The color should range from light like tan or to dark brown, and then anything abnormal such as yellow or red, you want to consult the veterinarian. And then the anal sac should feel pretty flat. And I'm just going to go ahead and clean his anal gland area.
Spray some lotion to the pile.
Alright, that's how you express anal glands. Okay, so I am going to prepare our enema solution for Kitty Cat here, who is severely constipated. So I've already added in this bowl about 60 ml of warm water, making sure that it's not too hot, make sure it's nice and warm. So I'm going to also add like a splash of chlorhexidine solution. Splash of that, and I'm also going to add some mineral oil. Just a splash of that. I have my lube here. And I'm going to use my tongue depressor to just mix that in. There. So, with that said, I'm going to go ahead and draw up about 12 mils of solution with the syringe, and I'm going to insert it. So I'll go ahead and get him to a table where if he has to poop, he can come out right in the sink. I want to get this on the table. Okay, so I'm going to go ahead and lube up my red rubber. And I'm going to measure from the caudal abdomen to the rectum, which is about 6 inches-ish. I'm going to go ahead and mark that with my marker. Side maybe, or our patient is pretty constipated. Slowly advance it. Then with pulses, I'm going to go ahead and push this through. I'm going to go ahead and clamp my tube off and sit for a few minutes in there. And then once that has sat for a few minutes, and then I'll take him back to his kennel. Today I'm going to demonstrate how to give a transdermal topical ointment called Vtht. Our kitty cat's not eating well, so this is like an appetite stimulant. So I'm just going to put like an inch strip across my finger. And I'm going to take that and put it into our patient's ear. Just rub it in there, in the inner ear. Now, patient shouldn't be able to lick at that or get at that because it's inside, so should be able to groom it outside of her ear, but not the inside. Alright, and yeah, that's how you give topical appetite stimulant for a kitty cat. Our dog here has a history of yeast infections, and he has a lot of hair in his ears, which trapped in debris. So I'm just going to go ahead and
Put her out on the. We did put her out on the balcony for a while.
use some cleaner, saturate that, and try to get around the hair. And I've already plucked some of the hair out. And mostly squeeze some of that in. I'm going to massage at the base. Use some of my Q-tips. And he can shake, that's okay, to get some of that debris up. I'm just going to wipe out the excess debris in the crevices. I'm going to use some Vtht, which is a broad spectrum antibiotic, antifungal, etc. Just use a tiny bit of that, just do a gentle squeeze. I'm going to go ahead and massage at the base. Alright. Alright, and do the exact same thing to the other side. So I'm going to go ahead and saturate my cotton ball with the ear cleaner solution, which is here. I've saturated my cotton ball with my ear cleaner solution. I'm going to go ahead and just roll it up and insert it here. And I'm going to go ahead and massage at the base of the ear. Hear that nice squishing sound. Make sure it's getting in there. Okay. I'm going to go in with a dry gauze. It's coming up clean. And if I did see any crevices, I'll just use my Q-tip because of the crevices and get that out. I'm going to go ahead and apply my medication, which is Vtht. This is an antifungal, antibacterial, antibiotic. Give it a gentle squeeze. You see the medication there. Massage at the base. And that's how you clean and medicate the ear of the cat. Alright, so I'm gonna start by cleaning my site first.
Hey, you're still here too.
Okay, so I'm going to demonstrate how to give sub-Q fluid. So I'm going to start by making a content of the skin, and right there at that indented area, I'm going to go ahead and put my needle parallel to the skin, bevel up. And undo my roller clamp.
So we did, but it was 4 days later.
Making sure not to give my fluid too high on the neck because it can cause abscesses, or so we tend to give them a little bit lower lateral but still dorsal, anywhere from the neck to the hip. Skin is not too tight. Making sure you're fine. Just close my put the needle out and hold off. That skin, make sure there ain't no fluid drips out. And that's how you give subcutaneous fluids to keep it. So these toenails are black, so I'm just gonna go ahead and take a little bit off at a time. Wait till I see the little quick, which I do. Then I'm gonna stop there. If I did make a mistake and click this guy, I will go ahead and apply our little quick stop and take a little bit and dab it on there to stop the bleeding. Just gonna do one more. Alrighty. Pushing the nail out so I can see where the blood vessel is at and where it stops. So I'm gonna cut a little bit before that. And if I happen to cut the quick, which is that little red blood vessel, then I have my little quick stop here, which I'll grab a little bit of that and just dab it right on that quick. So I'm just pushing the nail out, cutting, pushing the nail out, and cutting. Okay. All right, so I'm gonna go ahead and apply some lube, just so I can clip some of that hair that I see in there. Just so that some of that hair doesn't get in the wound. I'm gonna go ahead. This is a water-based lubricant, so I can just go ahead and flush that out with my sterile saline. No hair is in there. Okay. And then I'm going to go ahead and put some bandages. Okay, so today I'm going to go ahead and do an emergency wrap on Rena here. I did go ahead and flush it earlier, but our doctors went ahead and put some sutures in it. So I'm just going to do this for demonstration purposes. For demonstration purposes, I'm just going to put the wrap and stuff on it. I've already cleaned it and everything, so I'm going to go ahead and... So I'm going to go ahead and first lay down. Lay down. Lay down. Lay down. trying to do this by myself. Making sure you can see me. So I have my Vtht pad here. And I also have my antibacterial, antiseptic ointment on here, antifungal ointment. So I'm just gonna go ahead and apply a little bit on here. No, it's okay. I'm going to put that on directly on our wound. I'm going to go ahead and use my cotton roll and roll that on there. And this is again just the emergency bandage, just until the doctor can look at it, just to stop the bleeding. Making sure not to wrap that too tight. So I'm going around the elbow, over the elbow. It's a kind of awkward spot. So this is right in between the elbow. It's okay, Rena. It's okay. Good girl. Making sure to lay this cotton just flat against the arm. Making sure it's not too tight. Then I'm going to go in with my stretchy gauze. So I'm going to go ahead and a little snugly wrap that, not too tight. Just Rena, you're right. Rena, you're right. Go ahead and cut that. Then from there, I'm gonna go ahead and my vet wrap. So this vet wrap have little squares on it, so you want to make sure that when you're pulling the vet wrap over the bandage, you want to make sure that it's not like lines in the vet wrap, just those squares. You want to make it squares can be a little bit wider, but not like lines, so you're not putting it too tight. It's okay, Rena. Rena, it's okay. It's okay, baby. We're almost done. Good girl. Good girl, Rena. Cut that. Then I'm gonna go ahead and use some elastic tape. Just so this bandage doesn't slide down. So I'm just going to put that on the bottom of that and the top of that. And this is just going to stay on just for a few hours, probably shorter than that, just until the doctor can assess the wound. It's just to prevent that from sliding down. I'm going to start with my stirrups. And this is going to help prevent my the cast from sliding down. Just going to go halfway up its arm and go laterally on both sides. Use my tongue depressor to prevent the tape from so I got my stirrups in. I'm going to go ahead and start with my road gauze. So starting at the elbow, a little bit above the elbow. So I'm gonna overlapping, making sure to keep the road gauze nice and flat, and overlapping about 50% of each layer. And making sure not to get the road gauze too tight, but nice and snug. I'm going to go all the way down, and
There's a few ways to do this. You can cover the toes or leave the toes exposed, but to monitor slowly, I'm just going to leave the toes open. Exposed. And then go ahead and
go back up. These are mostly used to stabilize joints that have been fractured. I'm going to go ahead and go in with my stretch gauze. And that patient, he's just recovering from surgery that we did earlier. So for my stretch gauze, I'm just going to go ahead and put one layer over that cotton. Again, stretching it just to get it a little snug but not too tight. Just to help stabilize that cotton. And get everything nice and smooth. Alright, so now I'm going to go ahead and fold my stirrups over. Removing my tongue depressor and turning my tape inward. Laying it flat. Now I'm going to go in with my splint. So this is just for demonstration purposes, and my splint is a little bit long on the elbow, but typically we would just cut this to measure right at the elbow, but it's just for demonstration purposes. So I'm going to go in with my non-porous tape. Just going to just applying this just to stabilize that splint. Once that's on, I'm going to go in with my vet wrap. Again, so the vet wrap has squares in them, and that is a good way to indicate whether you're pulling the vet wrap too tight. So if there's lines in the vet wrap, then that's a good indicator that, hey, you're pulling it too tight. You don't want to pull it that tight. The squares can be a little bit rectangle, that's okay, but not in lines. I'm doing the same technique that I did with my roll gauze, just overlaying about 50%. I'm going to stop a little bit above that cotton. I don't want this vet wrap to rub on the forearm. You can cause irritation. I'll leave a little bit of that cotton exposed. Alright, so now I'm going to demonstrate how to remove this splint. So I'm using my bandage scissors, just sliding right under that vet wrap. You want to make sure that you're not grabbing any skin. When you go on it, you want to just wiggle those scissors. Wiggle, wiggle, wiggle. And you're going to do that all the way down. You want to slide underneath, but pull and wiggle and pull the vet wrap up. You know, for sure you're not grabbing any skin. going to cut bottom up. Then demonstrating the same. Parallel against the arm. Wiggle and pull up. That's how you place and remove a modified rubber band. I'm going to demonstrate how to give a cat oral medication. So I'm just going to use a cat treat here. So I'm going to open the mouth in here. And I'm going to follow it with some water to make sure that that doesn't get stuck in her esophagus. And when she licks her tongue out, that means she swallowed it. So, alright, and that's how you give a pill. That's what cat. Okay.
Okay, ready to go?
I'm going to demonstrate how to give a pill orally. So, first, we're going to make sure to get the back of his mouth. Follow it with some water just to make sure it doesn't get stuck in his trachea. Well, esophagus. And he swallowed it. Good boy. Okay. 3, go. Alright, so I'm going to take some dental x-rays. So first, we have the program called Vtht. So I'm going to try to get that left. Start with our premolar on the left side. I'm going to put that, and then I'm going to do the incisors. Try to do 3 of those. Okay, you can go ahead and put that position. Alright, so then I'm going to go over here and position my sensor. So, starting with that fourth premolar. Get it. Sensor. Okay, so head straight, sensors in, and I'm going to go ahead and angle that at about 60 degrees. And the program automatically sets itself for 2 seconds. So here's and that's our P4. So there we have it. And I'm going to go ahead and try to get those 3 incisors. Bring my sensor forward.
Did you do rounds on lady?
No. captured. Alrighty, and there's my 3 incisors. And we got actually got a little bit more, so. Alrighty, that's how you take down incisors. This is the one I took that with the P4, the carnasal tooth. The things you want to look for is bone loss, any bifurcations, lesions, any teeth that might be broken, which we would visually see those, but bone loss, pockets, which we still would use our probes, but we could confirm them on our x-rays. We'll go ahead and mark that in our chart. So that's that. And for this one, I don't really see a lot of, I do see some recession here, so I'll go ahead and mark that as well. And then so there's more, this view had a little bit of elongation. I think it was my angle, but these teeth are receded as well. So we have that bifurcation there. There's the bone there. So we'll go ahead and just let our doctor know and mark that in the chart here. So well, first I'm going to start with my correct, which is a blunt tip. And so I'm going to go parallel to the tooth, get underneath the gum line, and I'm just gonna scrape around. There will be some bleeding, which is normal. Scrape and pull down. Scrape and pull down. Trying to get under the entire gum. Okay, I'm gonna go ahead and flush the tooth. Make sure to keep our patient's head down. Alright, then I'm gonna go in with my hand scaler. This is a universal tip. So again, I'm gonna go in parallel to the tooth using the sides just to pull down. Nice, so the tooth is feeling nice and smooth, no scratches. I'm going to go ahead and brush your tooth. Alright. First, I'm going to start by getting under the gum line. Make sure to get around the whole tooth. Then I'm going to go parallel to the tooth. Making sure not to stay on the tooth for no more than 3 seconds. And if I have to, then I'm going to have to go to the next tooth. And I'll come back to that tooth and do the rest of the dental. Go ahead and polish. So the polisher that I'm using has a rotating cup, which generates a lot of heat. So I'm gonna make sure first that always I have paste in my cup. Never go on a tooth with no paste on it. And then making sure not to stay on a tooth that long because it can generate heat and can cause damage to the pulp. So also I'm making sure to keep the power at pretty low power. And I'm going to go under the gum line and make sure to get around the whole tooth. Just to fill in some of those scratches and can also remove some staining as well if there's any left. I have a few products here that I want to go over. First, I'm going to let you know that Fluffy did great for her dental. Teeth cleaned up great. There was a lot of tartar and build up on those back molars. So I'm going to go over some products that can help break down that plaque and tartar.
Okay.
So we have a few Vtht products. It goes by weight. there is an enzyme in this product called delmopanol, which helps break down the plaque and tartar. It also helps decrease the bad breath smell. So just that mechanical action of just chewing on that chew helps with that. And we do have a toothbrush, of course. Cleaning your dog teeth, brushing your dog teeth every day. It's just similar to us brushing our teeth. That plaque starts to get hard within 24 hours. So brushing the teeth, mostly paying attention to those molars. You can just apply some of this toothpaste, which has enzymes that break down that plaque and tartar. You can just apply it on your finger, or there's a finger brush in here which you can use and apply on those molars and just, brush it across. It doesn't have to be something that takes 5 minutes. Just something, just a back and forth motion a few times. And
the back teeth are most important?
Yes.
Okay.
So that's that. We also have some oral gel. I know it's hard trying to brush your dog's teeth every day. So these products contain enzymes as well that break down plaque and tartar, or to make it a little bit easier. We have some wipes that you can just put on your finger, which contains the same product that you can just wipe on those teeth, which makes your life a little bit easier. We also have a dental diet. This one says for cats, but we do have a canine diet as well. We just don't have it in-house.
Okay.
But this contains enzymes as well, similar enzymes to help everyday use. It does have a balanced diet, but this is only for our chronic cases where we say, okay, go ahead and get on this diet to help prevent tartar buildup. But you can give this every day as well. So there's a few items that we do have, depends on your everyday needs.